the lines on our skin that tell a story of healing. But as we've discussed previously, scars are so much more than just surface marks. They represent a complex healing process, and sometimes that process can leave us feeling tight, restricted, or even in pain. Today, we're diving deeper into a powerful way that you can actively support your body's recovery after injury, surgery, or radiotherapy. We'll explore how scars can sometimes create internal stickiness, what we call adhesions, impacting the intricate web of tissue known as fascia that surrounds our muscles, organs, and nerves. When this fascia tightens or gets stuck, it can restrict movement, cause discomfort, and even affect areas far from the scar itself. The good news is you don't have to live with these restrictions. In this video, we'll introduce you to the principles of gentle manual therapy, specifically focusing on massage and targeted gentle movement. These techniques aren't about force, they're about working with your body's natural healing process, encouraging better tissue alignment, improving circulation, and ultimately restoring your comfort and freedom of movement. Whether your scar is new and fully clothed or many years old, understanding how to approach it with mindful touch can unlock significant improvements in how you feel and move. Join us as we explore how these simple yet profound techniques can help you release tension, reduce discomfort, and reclaim fluidity in your body. Scar healing process. Let's start at the very beginning, the wound itself. When your skin is broken, your body immediately jumps into action. This initial phase is all about stopping bleeding and laying down a temporary matrix. Think of it like a rapid response team. Over the next few days to a few weeks, a delicate new tissue starts to form. This is where the initial strength is built, bridging the gap of the injury. It's crucial during this time to protect the wound and allow it to do its vital work. A wound is still considered a wound until the scab has gone. Be aware and look out for signs of infection. As your wound heals, keeping an eye out for signs of infection is crucial. An infection can significantly delay healing and lead to more prominent scarring. So what should you look for? If there's any increased redness beyond the wound edges, if there is warmth around that area that is different to the rest of your body, if there is swelling that gets worse, or a pus or cloudy discharge, there may be increased pain, or sometimes even a fever. If you notice any of these, it's important to contact your healthcare professional immediately. Early intervention can make a big difference. The remodeling of scars. Once the wound has closed and the scab has gone, the initial healing is complete. This is when the fascinating process of a scar remodeling begins. This is a longer phase, often lasting months, even up to 24 months post-surgery. During remodeling, the collagen fibers that formed the initial scar tissue start to reorganize and become stronger. The scar will often change in appearance, becoming flatter, softer, and less red or discolored over time. This is where gentle care can really make a difference. Hand hygiene and scar care. Now, let's talk about how you can effectively support this process. Firstly, and perhaps most importantly, always keep your hands clean when working on scars. Before you touch your scar, wash your hands thoroughly with soap and water. This simple step significantly reduces the risk of introducing bacteria and causing an infection, especially if the scar is still relatively new. Please ensure you wait until the site is fully closed and there is no scab. Hydrating and working gently with your scar. Next, hydrating the scar is key. Once the wound is fully closed and after your gentle massage, apply a gentle, unfragranced moisturizer. This can help keep the skin supple and promote flexibility in your scar tissue. You don't need fancy products. Often a simple cream is perfectly fine. In my opinion, I tend to stick to a natural product I use pure organic rosehip oil, but there are lots of different options to choose from, so choose what's best for you and your budget. When it comes to touching or massaging your scar, remember to work gently with your body, listen to its signals, and never work into pain. Scar tissue can be sensitive. Start with very light pressure for just a few minutes a day. As the scar becomes softer and less sensitive, you might gradually increase the pressure, but pain is always a signal to stop. Your body is telling you that you're just doing too much. The goal is to encourage the scar to soften and become more pliable, not to just cause discomfort. Scar therapy is a very gentle approach, as we are working through the upper layers rather than the deeper layers to begin with. Be patient and consistent, and remember that healing is a journey, not a race. How scars affect us physically. We often think of scars as simple marks on the skin, a visual reminder of an injury, surgery, or radiotherapy. But beneath the surface, a scar can tell a much deeper story. It's not just about what you see, it's about what you feel, and how these lines on our body can subtly or sometimes profoundly impact our daily lives. When our body heals after an injury, it lays down new collagen fibers to repair the wound. This new tissue, while strong, isn't quite the same as the original, uninjured skin. It can be less elastic, less organized, and less forgiving. This difference is what leads to many of the sensations and issues people experience. One of the most common complaints is a pulling sensation. Imagine a tight patch of fabric sewn into a stretchy garment. As you move, this patch pulls, restricting the natural flow of movement. This can directly affect your range of movement, making simple tasks like reaching overhead after surgery injury, or movement restrictions from the hips after abdominal surgery. Then there's the itching. It's surprisingly common and incredibly frustrating. This sensation can range from a mild irritation to an intense, distracting itch that impacts sleep and concentration. Scars can also play other tricks on the nerves. Many people report areas of numbness around a scar, where nerve endings might have been damaged or trapped during the healing process. Conversely, the area can also become intensely sensitive, a condition known as hypersensitivity, where even the lightest touch can feel irritating or painful. That feeling of tightness isn't just superficial. A scar, especially a larger or more complex one, can feel like a band constricting the skin and underlying tissues. This tightness can contribute to dull, persistent pain or even sharp, intermittent discomfort, particularly with movement or changes in pressure. Also be aware that keyhole surgery will have a more significant impact than just the scar on the surface of the skin. And sometimes the body gets a little too enthusiastic with healing. This is known as overhealing, leading to raised, thickened scars like hypertrophic scars or keloid scars. Now let's consider where this scar is located. A scar on the chest or abdomen, for example, might seem localized, but its internal pull can have far-reaching effects. If a scar from a lung surgery or mastectomy tightens across the rib cage, it can restrict the full expansion of the lungs, potentially leading to subtle or even noticeable breathing issues or shortness of breath. Similarly, abdominal scars from surgeries like bowel operations can create adhesions, and this internal scar tissue that sticks to organs. These adhesions can pull on the intestines, potentially impacting digestion, leading to symptoms like bloating, constipation, or even more serious bowel obstructions in rare cases. And for women, internal scarring can sometimes contribute to fertility issues by affecting the fallopian tubes or ovaries. It's a complex area, but highlights just how interconnected our internal systems are. Your scar is a testament to your body's healing power, but it shouldn't dictate your comfort or quality of life. Adhesions. So we've established that scars are more than skin deep. Let's delve into the key reason why they can cause such widespread effects. and that's adhesions. When our body undergoes injury or surgery or radiotherapy, the natural healing process involves laying down of new tissues. Sometimes in this process, the new tissues form sticky bands or fibrous connections where they really shouldn't be. These are adhesions. Think of them like internal superglue, binding tissues together that are normally designed to slide and glide smoothly past each other. And here's the crucial point. These adhesions don't necessarily stay confined to the surface of the skin where your scar is visible. They can extend much deeper, reaching into the layers of muscle, the connective tissue called fascia, and even binding to organs beneath. Imagine a scar on your skin is just the tip of the iceberg, where the adhesion potentially extends far beneath. Understanding adhesions helps us realize that scar management isn't just cosmetic. It's about restoring functional health and comfort throughout your entire body. So what is fascia? Imagine your body, not just as your muscles and bones, but everything inside you. Now picture a continuous, intricate, silvery white web that weaves its way through every single part of you. It wraps around your muscles, organs, bones, nerves, blood vessels, all the way down to cellular level. This amazing, often overlooked connective tissue is called fascia. Think of it like the clear cling film that wraps around everything in a package, holding it together, allowing it to slide, and giving it shape. Fascia is strong yet flexible, and it helps transmit forces throughout your body, allowing for smooth, effortless movement. When your fascia is healthy, everything glides nicely and you feel free. But what happens when this delicate web is disrupted? Let's start with surgery. When a surgeon makes an incision, they cut through layers of skin, muscle, and yes, fascia. And as the body heals, the fascia around that incision often forms new, less organized tissue. And these are what we call adhesions of scar tissue. This new tissue can be much less flexible, like a crumpled piece of cling film, causing tightness, pulling, and restriction in the easy glide of muscles and organs. It's not just the visible scar, it is the deeper fascia that's been affected. Then there's radiotherapy. While incredibly effective at targeting cancer cells, radiation can also affect healthy tissues, including fascia. The energy from radiotherapy can cause the fascia to become stiffer, thicker, and less pliable over time. This process is called fibrosis. Imagine that soft, flexible web becoming more like a hardened, restrictive netting. This can lead to persistent feelings of tightness, reduced flexibility, and sometimes a dull ache in the treated area. And finally, something as simple as the lack of movement can also impact your fascia. When we don't move enough, especially after injury or surgery, our fascia doesn't get the regular stretching and hydration it needs. It becomes stiff, dehydrated, and sticky, like a sponge that's dried out. This leads to that familiar feeling of stiffness, aches, and reduced flexibility, making it harder to get going even when you feel well enough. So whether it's from surgery, radiotherapy, or simply not moving enough, disrupted fascia can make a big difference in how your body feels and functions. Understanding this is a first step towards helping your body regain its natural ease and freedom of movement. Nurturing your healing journey, self-care after surgery and radiotherapy. The journey through surgery and radiotherapy is profound. It's a testament to your resilience, a chapter of intense challenge and incredible healing. But once the immediate treatments conclude, the path to your well-being continues. It's time for self-care, a conscious decision to nurture your body and mind, helping them fully recover and adapt. One of the most powerful tools in your self-care arsenal is you and gentle manual therapy. This isn't about deep, painful manipulation. It's about respectful, mindful interaction with your body. We begin with the profound impact of light touch. After treatment, areas can feel numb, hypersensitive, or simply not yours. Introducing light touch, helps to re-educate your nervous system. Think of it as a quiet conversation with your skin and underlying tissues. Feather-like strokes, circles, or simply resting your hand on an area can start to desensitize it, improving nerve awareness and foster a renewed connection between your mind and this part of your body. It's an act of acceptance and reintegration, signaling safety to your healing system. This can be a really emotional time, and that's completely normal. The most important thing to do is to be kind to yourself, and only begin this process when you genuinely feel ready. However, we've seen time and time again how this powerful method supports not only your physical healing, but your vital emotional connection to your body. As we gently progress, we turn our attention to mobilizing the body's fascia. Remember that incredible web we've just discussed. After surgery or radiotherapy, the fascia can become stiff, dehydrated, and bound down by scar tissue or fibrosis. Gentle manual therapy using slow, sustained gentle pressure and subtle stretches helps to release these restrictions. It's like gently ironing out wrinkles in that internal fabric, allowing everything to slide and glide more freely once again. Starting at the upper layers just underneath the skin, this renewed fluidity can significantly reduce tightness, discomfort, and improve your overall range of movement. This self-care approach is vital to addressing both old and new scars. For newer, fully closed scars, gentle manual therapy can help optimize the healing process, preventing excessive tightness and promoting better tissue alignment. It can reduce itching, sensitivity, and improve the scar's appearance. But don't think your old scars are set in stone. Even scars from years ago can benefit. Those long-standing adhesions and areas of fascial restriction can often be softened and released with consistent, gentle manual therapy. It's never too late to encourage improved flexibility, reduce chronic pain, and restoring better function to areas that have felt tight and limited for years. Your body has done an incredible job in healing. Now it's your turn to support it with kindness and attention. By embracing simple, gentle manual therapy, connecting with your body through light touch, and mindfully mobilizing your fascia, you're not only just managing symptoms, you're actively participating in a deeper, more profound journey of self-healing and renewed well-being. When approaching scar therapy, sometimes the most profound techniques are the simplest. It all begins with a fundamental act, one that we often take for granted, just the simple act of touch. Before you even make contact, take a moment to listen, not with your ears, but with your senses. What is your body telling you? Is the area sensitive? Does it feel numb? Can you move in a really fluid way? Are you hesitant? This initial awareness sets the stage for a truly therapeutic interaction. Next, connect. Place your clean hands gently on or near the scar. It's not about pressing or pulling yet, it's about making contact. Feel the temperature, the texture, and feel for any tension. And don't forget to breathe. This connection is not just physical. It's about re-establishing a relationship between your mind and this part of your body, because it has undergone change. And as you connect, be aware. Notice how that skin feels. Does it move easily? Does it feel restricted in one direction more than another? Are there any areas that feel particularly tight or tender with the lightest of touches? Your fingertips become your eyes, gathering information without judgment. Move slowly, allowing sensations to arise and pass. And throughout this process, above all, be kind. Your scar is a testament to healing, and the tissues are still adapting. This isn't a forceful battle, it's a gentle conversation. If an area feels uncomfortable, ease off. If you feel tired, stop. If you feel pain, stop. Compassion for your body is paramount in facilitating true healing. Celebrate every tiny shift and improvement, no matter how small. And don't forget that non-negotiable, keep those hands clean. Before any touch, ensure your hands are thoroughly washed. This simple act protects your healing skin and minimizes any risk of infection, ensuring your self-care ritual is safe and truly beneficial. Then finally, just say thank you to your scar and provide some moisture. Put whatever moisturizer you feel is best for you. The journey of healing is often one of immense challenge and profound change. Your body has endured, adapted, and healed. But as you emerge from treatment, a new vital phase begins. Rediscovering movement, connection, and a joyful way of being. This isn't just about physical rehabilitation, it's a holistic pathway, guided by 4 powerful principles. Listen, learn, love, and live. Our first step is to listen to your body and what it's been through. Your body is speaking to you, often in new ways. It might be whispers of tightness, murmurs of tenderness, or even outright shouts of discomfort. Don't rush past these sensations. Take quiet moments to tune in. Where does it feel restricted? What does that pulling sensation tell you? This listening isn't about judgment. It's about compassionate awareness, honoring where you are and this moment. Once you've listened, it's time to learn about it. Learn about our body. This means understanding your body's new landscape, learning about its restrictions. Where does it stop? Where does it resist? Exploring your current range of movement, not pushing into pain, but gently discovering your new boundaries. What movements feel easy? Which ones are challenging? Learn about your body's likes and dislikes. What types of gentle movement feel soothing and which ones aggravate? This learning is empowering. It transforms uncertainty into actionable knowledge, guiding your path forward with informed choices. When returning to activity, start off slowly, learning what your body can do now. This is perhaps the most profound step. Love who you are now. Your body may look and feel different, and that's okay. Your scars are part of you, a testament to your resilience. Embrace this new version of yourself with kindness, patience, and unwavering self-compassion. This love isn't conditional on your physical abilities or appearance. It's unconditional acceptance of what you've been through and how your body has reacted. When you approach movement from a place of self-love, it becomes a nurturing act rather than a demanding chore. It's about honoring your body, not fighting it. And finally, with listening, learning, and loving as your foundation, it's time to live. Movement isn't just about exercise. It's about re-engaging with your body, with your passions, and with activities that bring you joy. Step forward, gently but confidently. Integrate movement into your daily routine. Walk in nature, dance in your living room. Simply move with intention. This isn't about returning to your old self, but discovering a new, more adaptable you, ready to embrace all that life has to offer, with gratitude for the body that carries you through it. We hope this video has empowered you with practical ways to approach your scars. Understanding how gentle movement and massage can unlock your body's innate ability to heal and move more freely. Remember, every gentle touch, every mindful stretch is a step towards reclaiming comfort and confidence in your body. And trust yourself. Trust your relationship with your body. As you continue this journey of physical healing, we invite you to join us for our next video. where we'll delve into the deeply important yet often unspoken aspect of living with scars, the emotional connection. It's a powerful conversation that can be profound, healing, and accepting. Please also be aware there will be a range of videos that can help you with different techniques for your scar therapy, and these will be available online.